We've been called to the home of a 23-year-old female suffering from severe shortness of breath. It's a crisp sunny morning in early spring. Walking in, I noticed the absence of danger. There's no accessibility issues or obstacles. Upon visualisation of the patient, no sign of injury, for example, no pooled blood, no compound fractures, anything along those lines, apart from the patient's obvious discomfort and laboured breathing. So I walk in, introduce myself, I'll just say something along the lines of, "Hi, my name's Tom, I'm from the ambulance service. Understand you're having some trouble breathing, is that right?" At this stage I'd start unpacking my gear, check the radial pulse, for instance say it's fine. So
Yeah, my chest just tightened up really bad. I can't seem to get any air in my lungs.
straight away I have a response and can give this patient a GCS score of 15. Her eyes are open and alert and she's answered my question in a cohesive manner. We then look to gauge the onset of the suffering in this instance. So then I'd ask her a question, basically, okay, when did this start? Listening to the chest for any signs of wheezing or abnormalities.
About half an hour ago.
Were you doing anything in particular when you start to feel short of breath? Obviously, again, referring to the onset of the condition.
I was just running around with my dogs out the back and I started to get really short of breath.
I'd also commence taking vital signs such as heart rate, blood pressure, and oxygen levels. Each record relatively normal statistics, although oxygen levels are slightly decreased. I'd then look to give the patient some oxygen and just basically reassure her that this might help her out in the short term. So basically just, okay, I'm going to give you some oxygen, just relax and try and breathe slowly, and obviously place the oxygen mask over her face. I would observe the patient's respiratory system and general condition, including the significant effort, her increased rate and erratic rhythm of her breathing, also noting her laboured speech and pale skin. So this basically gives us a chance to review her respiratory system. We then look to gauge her pain and where she's at regarding her comfortability. And just ask you a question along the lines of, are you in any pain apart from your difficulty breathing?
Just my chest, it feels really tight, like I can't breathe properly.
Okay. Have you ever been diagnosed with asthma or had any other episodes like this? This gives us a question like that gives us a chance to establish a bit of a past history for the patient and eradicate some other diagnoses that may come through. Considering that the patient has identified only pain in her chest, I can eradicate some regions too in a head-to-toe inspection, concentrating primarily on the chest and abdominal region. So asking the question again whether or not she's been diagnosed with asthma or had any other episodes like this.
I sometimes get really puffed out when I run, but it's never been this bad before.
So we then look to, reassure the patient, let her know that she is perhaps having an asthma attack, and then administer the nebulizer. So just say something along the lines of, "It looks like you're having an asthma attack. Going to give you the nebulizer now, which should make you feel a bit more comfortable." Obviously, then fit the nebulizer mask to the patient's face. Continue monitoring vital signs, including oxygen levels. Hopefully, we can get that back to somewhere near stable. If there is Ventolin available, we'd administer that as well, of course. Whilst we've got the patient there on the nebulizer, we would continue to monitor her for 10 minutes or so, hopefully with some improvement in her pain levels and the ease of her breathing and whatnot, and make sure she's comfortable. If there's no change in her vital signs or her comfortability, we then look to transport the patient to hospital for further treatment.